It is really wonderful to be here today, and I just thought I would tell you a little bit of a story about Cora. Cora was my grandmother. She lived to 98, although if you ever asked her, she was 26. She immigrated from Ireland and was a fierce supporter of my brother and I growing up. Once she did find herself in hospital, which was always very much against her will, I would say, and I went to visit her, and she was asleep, and she was in the window in the sunshine, which she loved. She had her huge Jackie Onassis sunglasses on, which I still have, which is lovely, and she was sound asleep. And the nurse came in and she said, "Oh, I've got to give your grandmother some medications. Do you mind if I wake her up?" I said, "Oh, of course, that's fine." So she woke and she said, "Cora, could you tell me your full name?" My grandmother sort of looked at her and looked at me, looked back at her, didn't say anything. So the nurse repeated it and said, "Cora, are you able to tell me your full name?" I, by this point, was feeling quite sick in the stomach, thinking something has happened. And she looked again at the nurse and she said, "Darling, bear with me. I'm trying to remember which husband I'm up to." And, you know, by the time you are 98 and you have outlived 4 husbands and a couple of long-term partners, that, you know, does test the memory. But for my grandmother, it was the loneliness that she found most challenging, and it was certainly something I was so conscious of growing up. And I think her last year of life, where she did end up in Woolgoolga Aged Care Facility, and I don't know if anyone's here, but it was the most remarkable, amazing place we could imagine, she said, "I'm finally not lonely anymore." And it was such a beautiful experience for us to have her there. But for me, it's just such an interesting time, isn't it? In a time we've never been more digitally connected, never more in the whole world, and yet we are seeing some of the highest levels of loneliness. And when you think about the fact that 1 in 3 Australians experience loneliness and 30% of them do not live alone, there's something about that nurturing of the genuine connection that's obviously incredibly important. So I am thrilled to provide you with an incredible panel today, who I'm going to introduce, and then we're going to have a series of questions, but we do want to leave time for you to actually ask some questions yourselves. So without further ado, first up we have Associate Professor Michelle Lim. Why loneliness is such an issue for us here in Australia?
Mm-hmm. So for many of you have probably heard already, loneliness is an issue for Australia. So 1 in 3 of us experience loneliness at any given time. But this year, what we found was about 1 in 4 of us, when we feel lonely, we're staying lonely. So when we actually go back and ask people about how they feel down the track, you know, about 4 months down the track, they're still reporting persistent loneliness. This is an issue because we know that loneliness itself is an innate signal for us to connect. It's something that's natural. It's a natural response for us to do something different about our relationships so that we can reach out and thrive and connect with other people so that we can thrive. But the issue that we're having is that people are staying lonely. That's an issue. We now know in science, and we're looking at the literature, loneliness is bad for health and our community, but staying lonely exacerbates our outcomes, including mortality, so an earlier death, including morbidity of other kinds of disorders as well. So I think what we really need to do is, first of all, destigmatize loneliness so that we can feel empowered to get the help early. And speaking about loneliness in a way that is respectful, you know, ensuring that we all know what loneliness is because we've experienced it. But to find the tools and the skills so that we can speak about loneliness in a way that's helpful and respectful and in an effective way.
Yeah, and I think that's the important point, isn't it? It's that personal connection and really connecting to yourself as well as to others. And so, you know, my next question is for Angie and Josh around, really, you both work in such diverse organisations in your past as well as now, but what is it about loneliness and really addressing it that is so important to you personally? So Josh, I'll go to you first and then Angie.
Sure, thank you. I think for me, and we've all had our own experiences, when I get around our aged care setting, you can have the best environments, the best clinical governance, but if people are lonely, it's a really rough road for them. And I've had enough interaction through my career with great care but a sense of loneliness and a sense of loss of purpose, and deterioration just follows, and it can be really tough for people, and people don't always have the support network that you think. And I actually think the other thing for me is I'm worried about the growth in home and community settings without really tackling this problem.
Yeah.
You know, I think aged care generally gets a bad rap around residential aged care, but people can flourish in good aged care.
They can.
And now we've got 1 million CHSP clients in the community. Home care packages have gone from 70,000, I think it's about 240,000 now, and it will continue to grow. But with over 50% of people over 65, across our 7,000 clients, half of those people live alone.
Yes.
You know, I think that's a big risk for all of us. So that's why I think in our organisation, we're really trying to stump up to solve this, because I think it's a sleeping giant in our community.
Absolutely. And Angie, pass to you.
Thanks. You spoke about where my career started. I started in maximum security prisons. And hearing Andrew talk this morning, wherever you are in the room, was quite empowering for me to think about that experience and how socially disconnected he was from his community and the people that were important to him. But when I worked in a prison setting, we had a real big issue, and it was called tinsel and turkey. And it was a response to loneliness. We would have stable offenders, we'd move them out of the custodial setting, they'd be doing really well, they'd be thriving. And November would come, and it'd start to decline a little bit, the behaviour would change, petty theft, shoplifting, those types of offending behaviour. And I kept wondering why the same people kept presenting with the same types of things on a regular basis. And I spoke to my colleagues in the prison, and I spoke to my colleagues who were doing transitional care out in the community, and they said, it's tinsel and turkey. If you live alone, if you're lonely, if you've not got a lot going on at home, if you're in prison, no matter how tough an environment it can be, there are amazing volunteers, there are pastoral care workers. You get a Christmas present on Christmas Day. People celebrate Christmas and you're around other people. So even in that environment that Andrew spoke about this morning, that real challenge and that horrific place to be, people found comfort there because of that enduring loneliness in the community. And I'm really sad that 30 years on, it hasn't changed that much. We're still in the same space of how do we get better connections. So it's on all of us to make the environment that we have better so that people don't turn up to emergency departments or to the magistrate's court to be sentenced because they're lonely. That's a horrible testament to our society, I think.
Yeah. And I think staying with you, Angie, and building on that, and you have worked across such a variety of settings, what do you see as the main challenge in addressing loneliness amongst residents, but also, patients, obviously, but staff as well?
Talking about it.
Yeah.
Talking about it with each other, making sure that we're connected to each other. It's not just the patients and our residents and staff. It's everyone who we interface with on any given day. How are you? How are you tracking? Look for the people in your workplace that hang around a bit longer, that don't rush to go home. Talk to them about what's going on. Make and build connections and help people to feel connected is the best thing we can do. So if you are the person who is confident and feeling self-assured and you see somebody who's not, have a chat to them about how they're feeling, what's going on for them. Make it safe. We have things like Are You OK Day, but how do we talk about this all the time?
Yes.
And how do we talk about loneliness and take the fear out of that and the stigma out of saying, I'm actually quite lonely? Because it's really easy to be lonely in a room full of people. You can be here today and be sitting there going, I get that, I feel that.
No, it's absolutely true. And Josh, similarly, from your perspective, what are the challenges that you see?
I think growing diversity, I think, in the community is a challenge. I think we're seeing more and more in the community with English not a first language. And then you come into, be it residential care, independent living or community settings, where it's just not as easy to create those connections, and you can become isolated very quickly. So, most communities can be up to 20 to 40% in a lot of our services from a cold background, and in some communities even higher. So a challenge is having the infrastructure to make sure people remain connected in those environments. And I guess the other practical one is scale. You will always have pockets of excellence.
Yes.
But doing it across 5,000 or 6,000 staff and all residents so that we have cues and we're looking out for these things is a challenge.
Yeah.
It's a real challenge.
And so on that point of that challenge, what sort of the systemic or structural changes do you think that would need to be in place to really overcome some of those challenges?
I'll pick on one that's close to my heart. I think it's a cultural thing, and I think we have a challenge within our society of normalising loneliness with older people.
Yeah.
You know,
Yes.
you hear a lot about social isolation and loneliness for younger people, and if that's a problem, you're straight onto it. There could be investigation into it. But I do think that, unfortunately, in an aged care setting, it's a bit of a case of, well, that's just the way it is. People get lonely when they get a bit older, and
Yeah.
I think we need to break the back of that. I don't think it's normal that older people get lonely,
Yeah.
and I think the sooner we can break the back of that in terms of our cultures,
Yes.
you know, then we can make a big difference systemically
Yeah.
across our services.
Yeah, no, most definitely. And what was interesting for me from your report, Michelle, was around that change and shift in what we're seeing of the highest cohorts being sort of the 18 to 24-year-olds.
It is, but I also challenge my own data, because when you, with some data sets, we do see those spikes in the older adults as well, because you know, I think that when the way you administer the survey sometimes influences the results, and when you go on online surveys, you will influence the results. But the other thing I would really have to say for older people is that there's underreporting.
Yes.
People are really ashamed of talking about this. This is an issue where they go, well, I'm this old and I shouldn't feel that way. Younger people are really much more well equipped to have that language.
Yes.
They're growing up in an era of mental health where it's very acknowledged and very spoken about in schools. So they're more likely to say those things. I mean, the other opposite end of the spectrum, it could be, and plausibly, that older people probably have more skills than younger people as well.
Yes.
You know, they do know how to navigate because they have been through life, and maybe we can also indeed learn from some pockets of older adults who know they know what's like to have meaningful community, meaningful connection,
Yes.
and maybe our younger generation needs to learn from that as well.
Yeah, that's a great point. And I think, look, one of the things we definitely have been seeing a lot of is an increasing trend of people with severe loneliness presenting to our emergency departments, not necessarily being hospitalised, but certainly increasing in numbers. What change do you think are needed to really better address loneliness in the population, sort of more broadly, I guess?
More broadly, look, I think we need to build a culture of connection. You know, all of us here has a responsibility to actually do something different. You know, we're interacting or living in a world that, you know, it's easy for us to opt out of things. It's easy for us to have, you know, much more fleeting interactions. And we don't really favor in-depth, high-quality connection anymore. That's the way we live. We're also busy. You know, someone who wants to catch up for coffee is often, you know, pushed back weeks because we don't have the time. I always tell this story with Dr. Hugh McKay. I'm sure many of you know who he is. I see a lot of nods. He used to call me every day, not every day, every Friday and he still does. He would just call me, and often I think that initially when he started doing that, I thought that he needed something from me, and that's because the people that I interacted with always needed something from me when they called me. And so I went into these, you know, casual conversations with him on the phone, waiting for him to ask me something, and he never did. And it's because he practices creating meaningful, you know, social connection just by his routine. And I was so touched and impressed, and we still talk pretty often. But that's what we should be doing, you know. Whereas I was just living in this world where, when people are calling me, they want something from me. They want me to do them a favor. They're asking something. So I'm so prime, and of course I am busy, I'm sure like all of you. We need to really change and think about how we live our lives in a different way, not just from our home and family, in our community, in our schools, in our healthcare, in the way we live in our environment, you know, the way we build our roads, the way we have third spaces that are free and accessible. It is a holistic solution. It's not just a simple solution.
Yeah, and so thinking it through, Michelle, because I think, you know, and to Josh's point around that scale of, you know, we sort of identify something, it might not scale. Or the other aspect, I suppose, is each of us have our own unique kind of approaches of how, you know, we would like to feel connected, and that's going to vary quite broadly, of course, across people's experience or expectations. How do you think we can approach that issue constructively, so we're still making a difference but still having that individualised approach?
Look, I think we can make, each of us can make decisions, whether it's, you know, your family or to your work or to your wider community. I think we should not put this on the back burner. I think just talking about it now, and it's really easy to to go out and try to connect with people, or if you notice someone who's lonely, to talk to them. I think the issue that we have is that we don't know how to have these conversations.
Yeah.
We sometimes don't know who is lonely. Sometimes we assume someone's lonely, but they're not.
Yeah.
And people who feel lonely don't necessarily confide in us because they don't feel safe, you know, and they feel, in many ways, they feel like a burden, and they feel, they don't feel good talking to have this conversation because we're not making it in a way that's safe for them to do that. I don't think we have quite got the skills yet, and that's one of the big reasons why we started Loneliness Awareness Week, is to have to get everyone on the same page, because not many people know what loneliness is, and they get confused with social isolation. They're not the same thing. So starting with the language, starting with understanding how to have safe, meaningful, healthy conversations about it. We're still shying away, or the reaction is when we do know someone's lonely is either reach out and try to offer them solutions of what works for us, but may not work for them. And that feels very, very disempowering to the person who feels lonely. Or just try to ignore it because, you know, oh, they're going to take up too much of my time, so I'm not going to reach out because I might get caught in a conversation and I don't have time. So people are reacting different ways that are absolutely not helpful at all.
Yeah, and in terms of creating that safe space, how could people go about doing that, do you think?
Yeah, well, we need to understand, the way I often approach it is I never ever assume that I know what will work for that person, because loneliness is subjective. So I put on my clinician hat as a clinical psychologist, and I often say, you know, what can I do to help?
Yeah.
You know, what is it that worked for you in the past? Or what can you do now? What would you like to do? You know, I would never say, hey, you know, go and join this group because that worked for me, because often it just puts them in a difficult position. And loneliness as well, for some cohorts of the population, like young people and some older people, is actually highly comorbid with social anxiety. And so we actually know from the research, loneliness and social anxiety across 18 to 89 years old, they're bad partners in crime. So if you're lonely, you're more likely to be socially anxious. If you're socially anxious, you're more likely to be lonely 6 months down the track. Now, if you ask someone who's socially anxious to just go join a group, it's pretty terrifying. You know, you actually have to help them make little steps. So it's really, I don't want to trivialize loneliness. At the same time, I don't want to make it sound like it's a pathological condition. I just think that we need to find effective, safe, meaningful ways to try to connect with people and try to help people in a way that makes sense.
Yeah, I think that's very true, very fantastic. Thank you. And so, Josh, we talked a little bit about some of the programs that are in place and that you guys have put in place. Do you want to maybe talk about something that you've had in place, a bit of an innovative approach in your organisation or previous organisation that's really addressed loneliness?
Yeah, absolutely. And I actually think that was a great segue around having the training and the framework for people to be able to engage. So we've been actually running a Mood Mentors program across one of our services, piloting. So we've just had 10 of our independent living residents be trained through a Mood Mentors program to be able to, it's by psychologists, to be able to identify cues of anxiety or depression, and also lead indicators of loneliness. So 10 have gone through that training, and now they are now proactively seeing if they can help within a community that we have at Wurrunga, which connects with residential and wellness centres. And the thing that surprised me the most for the residents who went through that training was the impact that it had on those residents. We actually had one of them come back to us and say it has actually changed her life because she feels like she's got a sense of purpose. And she actually wasn't the target market. That wasn't the problem we were trying to solve. And we're now rolling out at 2 more of what we're calling caffeine-connected communities. So a lot of our services are built together. And I think if you can untap that latent capacity in a structured way of the genuine goodwill of people who want to help others, I think you might be surprised how many people there are sitting there who are really eager to help others and create those connections. But also a more well-trodden example, so we run a companionship program with our volunteers. So we've got cues built into our home and community visits. So if we see senses of loneliness or anxiety or We make about 1,600 calls a year based off those queues to home and community clients that seem like we should have a conversation. And the outcomes of that are either a mix of a conversation or we buddy them up with a volunteer and we have a social connection program. And so in terms of one of them at one bookend is this really innovative approach that I think is going to be wonderful. But we've got these other programs that are actually working well across scale as well, given we do have a lot of people we need to look out for. So yeah, we're tackling it at a few different angles, but there are probably two that come to mind.
Yeah, no, they're great. And I think, Angie, if I sort of come to you, so in order to put in place some of these innovative programs or approaches that really are addressing loneliness in a different way, what do you think are some of the structural or systemic changes that might need to happen to do that?
I think there's a couple of things. We need to start talking about it. We need to start talking about it with each other and with it. This isn't a patient problem. This isn't a workforce problem. It's a whole of society problem.
Yes.
And I loved what Michelle was saying about those little steps. It's incremental things we can do. There isn't one solution that's going to change the outcomes for people. It's going to be access to a portfolio of things. It might be the small steps of connecting. And I know there are some amazing apps just now where you can chat to somebody.
Yep.
Sometimes it's AI, as Joel showed us yesterday, and sometimes it's a real human. But it might be about those incremental steps of connecting with someone in a way that feels safe, manageable, and you're open to being a bit more vulnerable with that person. And sometimes that stranger can be a real different point where you can talk to someone who doesn't know you. You don't have to be burdened. You're not potentially asking for something from someone which we're compelled to do.
Yep.
So I think it's about having access to lots and lots of interventions. Things like peer support workers, and I don't mean patient peer support workers, I mean staff peer support workers.
Yes.
Allocating a buddy to someone when they start in an organisation. It's fantastic when you work in a big organisation and you feel a sense of belonging and you come in and you get the t-shirt and the uniform and everything and you have your name badge. But that's not all it takes more than that. And sometimes having someone who can help you navigate that and work out, who do you have lunch with? Do you do that? And it doesn't just happen at school, it happens to us as adults as well. So when we're talking about that social anxiety, those big things that happen in life, the new job, the walking into a new building, a new office, those are full-on things. But if you're also feeling lonely and you're feeling that exacerbation of walking into an environment, that's a real challenge. Yeah. So the more we talk about that, the more we put things in place to have supports for people to access or not, the better.
Yeah.
One of the great things we all have here and the commonality we have in this room is we are all part of a Catholic healthcare network, which means we have this amazing service called pastoral care. And those are the people who gently walk around our facilities and say, how are you today? And check in, and they are the first protocol that often asks. So let's not forget we have those incredible services already that are built into what we do. They build the humanity that we have and we bring into every day. So make sure we use those formal things that we already have and build on them rather than trying to reinvent the wheel.
Yeah. So I do want to leave time for questions because I absolutely promised that I would. I have one last question for each of you, and that is, when we all walk out of here today, what role can each of us play in supporting and implementing some of the changes, innovations and approaches that really address loneliness in our respective organisations? I'm going to go straight down the panel this way, so Angie, I'll stay with you.
I'll go back to what I said earlier. There used to be a commercial on TV in the UK, so any of the Brits in the room might remember it. It was for British Telecom, and it was "It's good to talk." The one thing we can do is talk. We're good at it. We should be connecting with each other. It may not be a physical phone call and a conversation, and I've just realised I aged myself massively by doing that and not doing that. But there is a part of this which is whatever communication method works for you, reach out and use it. If it's an SMS to a colleague who just looks like they're not having a great day, I know there have been times that I've felt lonely and somebody said, how are you? No, really, how are you? And took the time. So sometimes it's seeking to understand and hear the answer.
Yes.
And just stop and pause and ask.
Josh?
For me, I think what we can be doing, I know we all say we should be collaborating a lot more in this space, I would say. I think if you look around, if you agree that this is a problem in our society, in our community, and you then think about who's best placed to work through this, given our hospitals and our aged care and our mental health units and our social support, I actually think this network is the network that should be leading the way in this space. So I think we need to collaborate more, and that's on me as well. And I also think that we need to do what we can to not normalise that loneliness is okay in aged care. So I think that's probably one thing I would say. Well, it was actually probably 2, wasn't it?
That's all right. You can have 2.
I think the main thing that I thought of is really learning and understanding what loneliness is and what it's not, and understanding how to speak about it. And in that way, we address the stigma. 1 in 2 Australians who feel lonely say that they're ashamed to talk about it, and they will actively conceal it. So if we don't understand the issue, we don't, and also not discount the fact that all of us will get lonely at some time. So by understanding, we're learning how to manage our own loneliness as well. It starts from there, and having that conversation, and collaboration is important, because we can't end loneliness by ourselves, and that's why we're called Ending Loneliness Together, because one organization doesn't, we make an impact, but we really need different tentacles, different arms to really work across the corporate world, education, health, community.
Yeah.
And measuring loneliness would then allow you, and then identify and then measuring it would then allow you to track your progress with a lot of these programs. So Ending Loneliness Together has established a loneliness outcomes framework. Now these data is, or this framework is actually based on a huge psychometric study of over 20,000 people doing the same survey. And we actually found that this particular set of questions, whether you're 18 or you're 90, you're going to experience them the same way. So it's what we call age invariant statistics. We need to start measuring loneliness consistently. The issue that we have is that people, first of all, they don't know the difference between loneliness and other related constructs like social support, social isolation. In fact, the Australian Institute of Health and Welfare had the opportunity to measure loneliness, and they did it wrong, in a way that is such a shame, because when I look at that data, I was like, oh, we could have had great data, but we didn't, because they measured social isolation instead and called it loneliness. So I'm working with a lot of these organizations to try to make sure that we have this consensus definition. We work with the World Health Organization, the Global Initiative on Loneliness and Connection, and we establish a definition. The World Health Organization has launched a 3-year commission to social connection late last year. We are doing things like a global social connection index, so for the whole world, including low middle income countries, establishing definitions, establishing the evidence of what is needed. We know that loneliness affects cardiometabolic disease in some degree, but we don't know necessarily the mechanisms around that. So really clarifying those pathways, and also solutions that work. How do we scale up? Because as you mentioned, I think, they're very patchy. Like, we have these tested, solutions in pockets, but people don't scale up, and people don't have the resources to scale up. And what we're really interested in from the global perspective, and also I think from a national perspective is important as well, is that we need to find strategies and solutions that can be scaled up easily, that doesn't necessarily need a psychologist on the ground. Because how many communities have a psychologist on the ground? Even our remote regional communities, that's hard to come by. We need solutions that don't necessarily need those skilled staff to run. We need solutions or strategies that everybody can do. One example, just flagging, is that we've just tested the impact of kindness, for example, in our community on loneliness. And this is across the UK, USA, with Professor Julian Holt-Lunstead, who you've just quoted her research there, and in Australia. And we actually found that acts of kindness, at least 5 acts of kindness, was actually good for the recipient, especially for their loneliness, stress, social isolation. So that's something everyone can do.
I just think because, again, of who we are and our emphasis on spiritual well-being, that sort of mindfulness and the embedding of spiritual well-being into your model of care, I think is a way to scale unpacking this and helping to solve this in your organisation. Like, we've taken that so seriously that we've got 4 strategic pillars in our organisation, and I won't bore you with the 4, but one of them is spiritual and mental well-being. And we're resourcing up around that, because I think if you get that right, the rest falls into place, because it's that sense of meaning and purpose and connection, I think is a foundational piece for good care now in the health system, particularly in the Catholic health system. So great question, and absolutely.
Angie, did you want to add to that?
It's the opportunity we have that others don't have. We have this vehicle, we have this opportunity to have a connection to something that's bigger, and certainly that's one of the things we celebrate in our organisation, is being part of something bigger. Coming here to events like this helps us to reorient to that. What we do when we leave today is the important part of how we talk about this with each other, and talk about those connections we have in the spirituality and how we can find meaning from that. I know sometimes we wander and we're looking for a sense of purpose, and actually we can find it in a whole range of ways, but our organisations are actually set up really well to provide that for us. We just need to make sure that we open the doors and open the conversations to having them.
Yeah, I think that's fantastic. We are right on time. Thank you. And can I get everyone to just please thank the panel once again.